Hi everyone, Michael Ye here from the Endocrine Center. Today I'm going to talk about what type of thyroid cancer operation do you need. Now this means that if you're watching this video, you've had a biopsy and it showed thyroid cancer. Most likely it showed papillary thyroid cancer, which is the most common form of thyroid cancer. It accounts for greater than 90% of all thyroid cancers diagnosed in the world in 2024. And thankfully, it is the most slow-growing form. So there are three possibilities in terms of the type of operation. One is thyroid lobectomy, removal of half the thyroid gland. The other is total thyroidectomy, removing both sides, the entire thyroid gland. And the third is total thyroidectomy with lymph node dissection. All right, who should get a lobectomy? Lobectomy is most suitable for patients with an intrathyroidal tumor less than 4 centimeters in diameter. What do I mean by intrathyroidal? It means entirely contained within the thyroid. No invasion and no metastases. And specifically, I'm talking about no lymph node metastases to nearby lymph nodes in the neck. More than half of our patients who are diagnosed with thyroid cancer are adequately treated by lobectomy. All right, so that's probably the most common choice. Second, who needs a total thyroidectomy? First, if your tumor is greater than 4 centimeters in diameter. Second, if you have multiple thyroid cancers within the thyroid that can be seen on both sides, for example. The third, a relative indication, is an isthmus tumor. That means one that's right in the middle, and often that requires a total thyroidectomy. All right. The last reason you might need a total thyroidectomy is if your surgeon, when looking at the ultrasound, sees that the thyroid cancer is starting to invade, right? So getting outside the thyroid, getting into a nearby normal structure such as muscle, maybe even getting close to the airway or trachea, those people need a total thyroidectomy. Now, you notice I just said surgeon-performed ultrasound. I personally think that every patient, I'm going to perform the ultrasound on all of my patients because the quality of my operation depends on it. I really have to have a three-dimensional view of everything that's going on in that person's neck. I need to know the relationship between the thyroid cancer and the nearby structures. I need to know what is going on with the lymph nodes. Why do I need to know? I don't want any surprises on the day of surgery. I want surgery to be really boring and planned. That's what I love. All right, so who needs a total thyroidectomy and a lymph node dissection? Well, you saw abnormal lymph nodes on the ultrasound. It could be in the central neck down here. They could be in the lateral neck here on the side. And that is a very nuanced, very subtle thing to find. Each year we look at thousands of lymph nodes, and you figure out which ones are normal and which ones are abnormal. So we here at the Endocrine Center, we do personally, the surgeons, not a technician, not a radiologist. I'm sure those people are perfectly fine, but we, the surgeons, do all of our ultrasounds. And that way, we know exactly what type of operation you need. So the importance, once again, of surgeon-performed ultrasound in selecting exactly the right operation for you. Not too much surgery, not too little surgery, just right. Thanks for listening.